What are the minimally invasive treatments for enlargement of the prostate? I'm Dr. Kent DeLay, a board-certified urologist in West Columbia, South Carolina, and today we're going to talk about procedures for enlargement of the prostate, which can be done in the office. While there are a variety of technologies in the pipeline for BPH, there are two dominant technologies. Both procedures are part of a group of procedures called minimally invasive surgical therapy for the prostate, or MIST for short, meaning that these can be done in the office setting without general anesthesia. MIST therapies are less invasive and allow for a quicker recovery. They also carry a very low risk of ejaculatory dysfunction in contrast to more standard treatment options. Part of the trade-off, however, is less invasive therapies are probably somewhat less effective overall and nearly ineffective if the prostate volume is over 80 cc's. Most studies show that less invasive options are more likely to need retreatment with more medications and potentially other surgeries down the road. They also bring about less dramatic improvement in symptoms and flow. So let's talk about the two options: UroLift or prosthetic urethral lift and Rezum water vapor steam therapy. The object, regardless of the approach, is to create a wider urinary channel to allow for the better flow of urine. We'll start with UroLift, or what is called prosthetic urethral lift. This procedure allows for compression and pinning back of the excess prostate tissue with UroLift implants or clips. The procedure can be done in the office or OR setting depending on the patient and surgeon preference. The number of implants required depends on the length of the urethra and the size of the prostate. Most patients do not require a Foley catheter and have very little need for narcotic medication after this procedure. It usually takes about 2 weeks for the swelling from the procedure to go down and for men to notice significant improvement in their symptoms. The goal is to discontinue any oral medications being taken for enlargement of the prostate. There are some limitations. One is prostate volume, which is determined by ultrasound or CT and needs to be less than 80 cc's. While some surgeons will implant patients with a median lobe, I believe this procedure is less effective in this setting and usually recommend alternatives when I see a median lobe on cystoscopy. So what are the odds you might need some other procedure if you get a UroLift? A recent real-world study suggests that the retreatment rate is about 6% per year. So if you extrapolate that to 5 years, about 30% of patients will need another procedure. So my overall message would be that UroLift makes a lot of patients better if properly chosen. The recovery is easy. The downside is that the durability of the procedure may be somewhat less than other options, and you may need other procedures down the road. Let's move on to Rezum. Rezum is water vapor steam therapy. What does this mean? This procedure is generally done in the office. To keep you comfortable, we use nitrous or laughing gas in addition to local anesthesia. A scope is placed into the urethra and into the prostate, and steam is injected into the excess tissue, which is blocking the channel. This causes necrosis or cell death. The death of this excess tissue causes a wider channel to develop. This procedure generally does require a catheter for several days after the procedure. Burning after the procedure is very common immediately, but usually resolves in about 2 weeks. Because it takes some time for this excess tissue to go away, it may be a month before you notice an improvement in your urinary symptoms. This procedure rarely causes problems with ejaculation. In about 5% of cases it does. The surgical retreatment rate for Rezum isn't entirely clear from the literature, but is probably around 3% per year, so somewhat better than UroLift. Compare this to more invasive prostate procedures, which have a retreatment rate of 5% total at 5 to 7 years. This is definitely more. So both of these are good options for the right patient willing to accept the trade-offs. Here we have two less invasive office procedures which are not likely to affect sexual function, but do have a higher rate of retreatment and a less dramatic improvement in symptoms. So I hope this review and content was helpful. If it was, please like and subscribe and turn on notifications so that you can see future content as it is released.